Well, hello everyone, and thank you so much for being with us today. We have a very special guest with us. Dr. Bensmail is with us. I always mess it up. It's my way, I guess. Dr. Bensmail, thank you so much for being with us. Today we're going to talk about vaginal wellness, or looking at all the different possibilities. And I thought it would be a good idea just to give you, or for everyone to know more about all the different services and products that are available in the markets. And today there's so many choices. So Dr. Bensmail, thank you so much again for being with us. Today the class, our conference will be sponsored by Nelly Deveuse Biofemme. So we're very happy to introduce Biofemme a few years ago. Going back, still considered as a new innovative category of cosmetics. 10 products for labia minora, labia majora, so a full women's wellness product category. Nelly Deveuse has been recognized around the world with the benefit of having the certification of EcoCert, Cosmos Organic, and beyond, having results. So we're very happy to have the Biotense product. I've been myself with Nelly Deveuse for more than 38 years. We're also proud to say that many dermatologists around the world recommend, prescribe the Bioacne line, which is also new in Nelly Deveuse. So with the full claim of anti-acne that really delivers results, but fully organic certified. So it's really the new way. I think we were looking for more sustainable product, and more importantly, we're thinking about our health. So we're proud, and of course the entire line, anti-aging line, Bioscience of Nelly Deveuse, for the sponsorship. Nelly Deveuse is seen in so many magazines around the world. So if some of you are interested to find out more about it, you can visit nellydeveuse.com and look more. And also there's educational capsules or videos that you will find on YouTube. So if you just go on YouTube and dial Nelly Deveuse, you will see all the different products, services, information, education, everything you need to know about acne, everything you need to know about all the different possibilities. And we're very excited to say that the Biofemme team, at R&D team with Nelly Deveuse, I should say, at the laboratory, is the one that innovated and discovered the importance of the pH of the vaginal microbiota, and basically discovered that the importance of the pH, healthy pH, has to be anywhere between 3.8 and 4.1 in order to be healthy. So we're going to talk a little bit about this later. There's a full category of products in the Biofemme. So anything to do for dryness, anything for skin rejuvenation, skin tightening, of course, ingrown hair, and of course, candidoses or product, when you have problems with yeast infections. So this is the entire line. But now, enough commercial. We're here today with Dr. Bensmail. So I'm so excited to have you. Again, thank you so much for being with us all the way from France. And of course, with the time difference, thank you again for being with us.
You're welcome. It's a real pleasure. Yeah, well, you're welcome. It's a real pleasure to be here with you and to talk about one very important topic, not only for me, but I mean for all women all around the world. So it's quite important that it's so also very important that awareness of intimate issues has to be every woman have to take a really important part of her own life by herself and ask questions and go and ask for some doctors, specialized doctors.
Yeah, and I remember, if I may say, when we first met, I think it was at the American Academy of Aesthetic Medicine in Las Vegas. I was very impressed with all the knowledge you have, and of course the specialty. It's becoming a demand category. There's a lot of cosmetic demand, of course, within the vaginal area, and we're always shy as women to discuss, with our gynecologists, what are the different possibilities? What kind of services can we offer to women? So first, I wanted to ask you a little bit about your experience. Like, I know that you are so recognized that people travel the world to come and visit you and get services from you in France. So again, we're very proud to have you here. But if you don't mind giving us a little bit of a history about all your experiences.
Well, maybe I would like to share with you two short stories. One first, it's an example of what is cosmetic gynecology and what we are doing. First one is, I remember one patient, she had an appointment with me, and I saw on my schedule, she had, I don't remember, 85 years old. And it was my last patient of the day, and I had some stairs, so I went downstairs, and I was looking on the waiting room. I didn't see the patient, so maybe she won't come, I don't know. And I saw one woman, she looked like 65, and I asked her, "Are you Mrs. Smith?" And she said yes. So she was 85, and she looked like less than 65. And then she came to my office, and she was really shy about talking about special topics. And actually, she had a new partner in life, and she had dyspareunia for more than 15 years. And then the problem was that she didn't want this new partner to go away, because it was really an important problem for her. So this is
I can
why
imagine.
we are
I can imagine, but you know, it's amazing what you just said. If I could just, you know, the fact that women today, men, with all the different technology, aesthetic medicine, there's so much things that we are learned that are available. We're able to maintain the skin's health, and we're able to improve, then, you know, drop some age in the face. But now we're going in that focus, and we're looking at, you know, different possibilities that are there. So it's interesting what you're saying, and it's so true, you know. So so can you give me like, for example, what would be a typical, if I may say, what is or the most popular services that you offer?
Most popular, it depends on the ages. Most of postmenopausal women are suffering from dyspareunia and dryness. So this is the two main symptoms because of lack of estrogens.
So for the consumers that are with us, just dyspareunia, can you explain just a little bit what it? Yeah.
So it's pain during intercourses, and it's due to most of the time due to dryness. So intimate dryness, it can be every day, but also it's crucial during intercourses. And this is it's really the majority of patients after menopause, they are suffering from these problems. So it's quite common.
Or at menopause, like around 50 years old, you hear a lot, like within the communities, we hear people like, oh my God, I'm starting to have, Yeah,
we say statistics say that it's between half and between 30% and 50% of women starting at the menopause are suffering from these symptoms. And
so what's the solution?
So solutions are first prevention. It's an everyday care. It's choosing the right products for intimate care, and not waiting for symptoms to go worse and worse and worse time after time, and starting first easy non-invasive treatments at the first symptoms. And one of the first and easiest treatment I do is hyaluronic acid injections.
Okay, so hyaluronic acid, so injections, injectable aesthetic.
Yeah. So we are injecting the product just below the mucosa to give hydration, moisturizing, and to ease the pain and dryness.
So that takes care of, automatically, I'm sure it takes care of the pain, but like you said, the maintenance, or making sure that the bacteria that are so necessary to keep our moisture, the lactobacilli bacteria that, you know, for our pH to be always healthy, to give them some food, some prebiotic, so that we can keep it, keep it maintenance, to keep that maintenance, so we don't have that dryness, right?
Yes. So, of course, we are giving a treatment, but it is not enough. I mean, it's a start, and we have to do everything else every day to keep it lasting longer in time.
So in our case with Nelly, of course, with the Nelly Biofam products, we use the regenerating oil to remove that dryness, made with onagre, in French, evening primrose, and it just helps to soothe and hydrate. And on a daily basis, we use the prebiotic, the pH, the pH solutions, the pH gels. So that would be one function. What about women that we hear so much that say they have a tendency to have incontinence, meaning they have some drips or drops every time they do exercise or they jump, or they're about to reach to the bathroom and then suddenly just they have some.
Yeah, it's quite often, and a lot of women think that it's normal for them. I mean, they think that it belongs to them, that they will have urine leakage after doing sports or some exercise, but it's not only them. It's majority of women suffering from time to time, or maybe more often, from this kind of problems. So the most important is to be aware that the pelvic floor, we have a lot of muscles. So we have to train those muscles every day to maintain a balance.
So you give exercise to make sure that it remains tight, so you're able to hold it. Because like you said, everybody thinks, oh my God, I'm the only one. I'm not going to talk about it to my gynecologist because it's embarrassing. I just have a leak, a little bit of leakage. And so, it's a lot of women, they keep it for themselves. They don't share. So you're right.
Yes, they are shy about these problems. But we have to, as a gynecologist or urogynecologist or any specialist, we have to ask the questions, because otherwise it's still taboo problems.
Yeah, exactly. We're embarrassed saying, oh, my underwear is wet a little bit. So it's something that we would never think of discussing, or most people won't discuss. So they keep maybe skin tightening they can discuss, but not so much, having a little bit of incontinence, unfortunately. So what about the tools, that they sell online, or there's different, devices that they recommend to besides your exercise? Would you also recommend?
One of the easiest way are the Kegel exercises. So you don't need any tool, and it's everyday practice.
Discipline.
But if you have more severe problems, there are home use electrical devices that will stimulate the pelvic muscles, but you have to do it like it's 2 months protocols, 4 days a week.
So it's long, and it could be, a lot of people don't have that discipline.
Yes, you have to have discipline, otherwise it won't work. So, but it can be really helpful. And on the other side, yes.
So no, I was about to say, so what's the other solution, the quick solution? What can women do for incontinence, or a quick fix?
One of these, the latest techniques today, and I'm using one at my office, are the magnetic chairs. It's pulsed magnetic waves that will stimulate your pelvic floor muscles without any need of vaginal probe. I mean, you just sit down a chair, you are fully closed, and you work with your muscles for 15 minutes, and you have to come 2 times a week, and within 6 sessions, you gain a lot of power.
So that's like ideal. So 6 treatments, and you're basically, you don't have no more incontinence. And that, I would say, for mild as well as severe incontinence, right?
Mild, not for severe incontinence. Most of the times it's not enough. I mean, you have to go for surgery. But for non-surgical problems, or at least if you are intending a surgery, but the patient is not really comfortable, she doesn't want to go on the operating room, then it's really, really efficient. And
so now we take care of the incontinence, we took care of the dryness. We took care of the incontinence. I mean, the muscles, I should say muscle, not incontinence.
Yeah, the muscles.
If we do have problems with the leakage, right? So that's taken care. What's next?
For incontinence, there are two kind of issues. First issue is, as we said before, is the pelvic floor muscles. It's one thing. And the other thing is the vaginal tissue elasticity. After childbirth, after aging, we know that we lose every day collagen fibers, elastin fibers. So the tissue is losing elasticity 100% of time. So
it starts to sag, or we start losing volume in our face, and then of course everything is starting to lose volume overall. So we need another solution there.
Then you have to restore this tissue and restore these fibers, restore the collagen, restore the elastin fibers. And we have devices since maybe now more than 10 years. We are using a CO2 laser, fractional CO2 laser, and closer to us radio frequency that are really, really efficient.
And
so of course it's not only in one session.
And why would you choose a radio frequency versus a CO2 fractional laser or erbium laser?
Actually, I used CO2 laser 10 years ago. I was one of the first in France to use CO2 lasers, and I switched with the radio frequency 4 years ago because it's really more comfortable for patients.
So less invasive, less painful.
Yes, because laser is ablative, so you are ablating tissue on the surface, and this will create the restoration. For the radio frequency, it's the wave, it's a heat wave, so it's a homogeneous wave of heat. So you don't need any abrasion, any ablation. So it's really more comfortable without any downtime. So I mean, the patient comes to you, and as soon as it's finished, she can do whatever she wants. But
let's say if I, I'm sorry. So let's say if I have if you have a laser patient, how many treatment versus radio frequency to get the same result?
Almost the same. The difference is that for the laser, you have to wait 6 weeks, 1 month between 2 sessions. You have to wait 1 month, and usually you use 3 to 5 sessions for lasers. So it lasts 3 to 5 months of treatment. With the radio frequency, you don't need to wait 1 month. You can only every 15 days you do your session, and within 4 to 6 sessions, the treatment is over. It's done. 4 sessions.
Oh, so that's fast. And you have as good results.
The same results.
Wow.
Yes.
Okay. So so there's the treatment. So now we tighten the skin, we create new collagen, we plump up the skin with either laser or radio frequency. What would be next?
Next, you mean for incontinence?
No, let's say, okay, so I took care of my incontinence. I took care of skin tightening, dryness. Would you say, how about, I remember in the class when I was at the American Academy of Aesthetic Medicine, you were talking about anal bleaching.
Yes.
Yes, so tell me how popular it is, and what do you recommend for these?
Actually, yes, because depending on some countries, we have demands for skin whitening and intimate area whitening. So we have some products, some chemical products. It's like peelings. So it's
like alpha hydroxy acids, let's say AHAs type of products?
TCA, yes, it's TCA, light, low dose, low concentration. And also CO2 lasers have some tools, some special handpieces to use on the vulva for whitening. And the same as radio frequency, we have fractional radio frequency that with the thermal effects, you can have a superficial dermabrasion, so you whiten the skin. But it's not, I mean, you have to maintain this. So you can combine light peelings, for example, chemical peelings, and thermal devices. And of course, you give your patient some home use products
Yeah.
that are less deeper than the product we are using, but it helps to maintain the color of the skin for a longer time.
And I think, you know, from what you say, I think it makes sense if they do it at home with a low pH, like as I would assume pH that are not too aggressive, like a pH 3,
Yes,
3.5. It would be gradually, and it won't hurt. I mean, of course, the pH, vaginal pH has to be maintained, but at least it's acidic. And of course,
it's not painful. It's really not painful, so it's easy. Yes.
Very interesting. And what's next? Like, is there something that's coming in, or some new techniques, or anything else that you would recommend that's also becoming popular for this this area?
New techniques. We have. I mean, the main idea is to go for the less invasive techniques. So we are going from surgical techniques to non-surgical. So we are replacing some protocols we use in surgery, and we do the same with non-invasive techniques. So for tightening, it's the same. We have perineoplasty or vaginoplasty surgical techniques, and we are using non-invasive techniques. So we have, like, for example, labiaplasties, and we have devices with radiofrequency needles that really have, it's quite new. It's like maybe last year the devices are coming, and we can have, for some labiaplasties, we can have the same effect without any future, any postoperative problems, or so it's really interesting.
Yeah, because it is still invasive, even though it's still
Yes.
popular. In the US, they were saying, you know, it's becoming one of the most popular surgical procedure a few years back. You know, they were going for a breast implant at the same time doing labiaplasty. So would you say in Europe, was it also very popular?
It's maybe not so popular, but it's one of the most popular operation in Europe and in France. Yes. I think in France, maybe I don't know in the US or in Canada, the ranking of labiaplasty. In France, I think it's maybe the fourth or fifth fifth procedure.
Well, it's incredible, and it's really definitely, you know, it was in demand, but now you're saying that definitely people are not looking for invasive, going for more regenerative or technology or even aesthetic injectable services to just fix the problem without going through this severe, severe, I guess, trauma.
Yeah, severe bleeding, hematoma, infections, and every kind of issues you can have with surgery. So, and of course, also, you don't need to go to an operating room. You can just go do it in your office or in dedicated area in your office. So it's simple, it's less stressful for patients, and the downtime is really not, there is no downtime. Most of times you can do it under local anesthesia or topical anesthesia sometimes, so it's really easy.
Nice, very nice. There's so many options, and I find that more and more consumers are getting you know, more educated because of the social media, and realizing, especially I don't know, within the COVID time, people staying at home and unfortunately eating a lot more sweets and sugar, and of course the candida albicans, you know, the pathogenic growth starts to take place, and then we have mycosis. We're, you know, having yeast infection. So have you seen a lot more demands because of, I mean, of this imbalance, I would say, within this time?
I think yes. I noticed this because we started here in France. Now it's about 1 month, and I noticed more demands about vaginal imbalance. So every kind of you know, leukorrhea, itching, and these problems. Sometimes maybe half of my patients on the day have the same problem. It's due to a pH imbalance, or due to pain during intercourses because of dryness, because of stress, because of lack of sleeping, or you know, all these problems we are facing these last months. And
Yes.
sure that we see that a difference these days.
And it's affecting our whole immune system, really. So we're all feeling it down there. But, you know, I think people with, like you said, with stress, and in my case, I always refer to me, you know, we refer to even PANTS, like people like myself was so predisposed. And one thing I was really impressed when I first met you is that you cared as a gynecologist to really care about the pH, because not many gynecologists really, you know, take the measurements or actually discuss pH balance with their patients. And I thought this was nice because, you know, people like myself that are so predisposed to yeast infection, wearing a pair of pants, you know, and you see those young kids, like my daughter, she wears those tight clothing, or maybe G-strings that's popular, but it's affecting that friction caused heat. And then people like myself who has more Candida albicans production, and then they become pathogenic, then we have yeast infection. And so we have so this is how the zone control in the Nelly Biofam, you know, somehow you know, the discovery of this whole line started. And the fact of using, there's so many products. I'm even surprised, you know, you go to pharmacies, you go online, and you see the amount of product in that category. There's so many options, and it's consumers. I mean, we are so confused, right?
Yes. Yes, and there is a need of some knowledge. We have to know how it works. And we need to explain to women how their body works, because I mean, when you know the patient is coming to you, as she says, I have a Candida albicans, so we treat it, but the next month it's the same and the same. So I see many patients coming to me, and they saw already, I don't know, 10 gynecologists before, and they come and say, it's always the same. We treat the problem, but the next one is always the same. And then you explain to them that it's not a problem of Candida albicans, it's a problem of the balance. And as soon as you don't have the balance, you will always have the same problems. So you have to treat at the beginning, not to treat afterwards. Otherwise, you are always late.
So prevention, like, you know, the ones that are predisposed, they don't, if they're going to go in a pool that's with chlorine, they should prevent and make sure that it's always in balance.
I have to know that, yes, I'm going to the swimming pool, so I know that I need to do before something, not afterwards. Otherwise, the problem would still be the same.
Yeah, and it's, you know, now that it's available with natural and especially organic, there's so many other, you know, options. It makes it easy. It's like even this summer, you know, we go on our bike, and just the friction heats and then unbalances all our little microbiomes in there, and so we become unbalanced. So you're absolutely right. I think it makes such a difference. Again, I want to say thank you for being so generous with your time, and also help us to understand more of all the different services and opportunities. Is there any comments or things that you would like to share, maybe that we didn't cover?
No, I think we covered already a lot of things, but maybe the main thing is empowerment of our own health, because it's quite important. I think it's to be empowered of our own body, our own health, and also to the knowledge. I mean, we have to read, to watch, to learn, and to ask the questions.
And if I were to ask in your practice, or generally speaking, if you were to say that a price, let's say a woman 50 years old, starting to have this a bit of leakage, starting to have dryness, starting to become losing volume, what kind of budget should they actually plan for, to be complete, not completely, but to be rejuvenated without surgery? What would be the right range to think about?
Well, so it depends on the countries, of course. So
Yes.
I will take my own example. So in mainly, if you use energy-based devices, globally, the price for the whole treatments would be around 2,500 euros. I would say, maybe let's say 3,000 euros. This would treat urine leakage, local atrophy. If you want more aesthetic things, so not only functional problems, but also aesthetic problems, then you would have maybe injections or more specific local treatments. I would
So
say,
injection, can you just specify a little bit more? So they come for injection of hyaluronic acid, you mentioned earlier. Is there other product, is PRP maybe popular, or other
yes,
types of?
atrophy you can use, yes. This you can use for mainly for the introitus from the fourchette. You can inject hyaluronic acid or PRP. It's really interesting. The PRP is really interesting for lichen sclerosis, for example, or major atrophy, or after radiotherapy, for example. So the most severe cases, it's really helpful. You can also use I would say in English.
Oh, French is all good.
Adipose cells, adipose derived stem cells.
Oh yes, of course.
Yes,
It's
adipose
popular.
derived
Is
stem
it
cells.
popular in France? Very popular for this
Not
particular
not
vaginal
so
area?
much.
No, not so much.
No, we are just at the beginning, but it's really interesting because it's easy to harvest, and it's easy to inject. So it is.
And does it remain? The question is, does it
Yes,
remain? So let's say you create that beautiful plumpness, but is the plumpness goes, or?
So if you inject adipose derived stem cells, yes, it will last longer than the PRP or the hyaluronic acid. So this is interesting. Maybe it can last 2, 3, 4 years. So you don't need to repeat as often as the other products.
So for sure more expensive, but at least another alternative.
Yeah.
Interesting.
So on this area you can inject. You can also inject on the upper part around the G spot. It's called the G spot. This to enhance.
We're going into this taboo area now.
Yes. And it's also said to enhance, to prevent incontinence also. If you stimulate this area, there are some studies that are showing that you have less incontinence.
Really?
So,
interesting. Yeah. So this injection between PRP or stem cells and even G-spot to enhance skin rejuvenation, bleaching, so many options, so many opportunity for this small area, but that makes, I guess, a big difference for a lot of women that are so thought that they were the only one living a problem, and especially when I find that, as menopause is defined as you don't have your period for 1 year, generally speaking at age 51, I find that starting at age 51, even though we all know that, they say, oh, at age 30, your fibroblast cells does not produce as much elastin and collagen, so it's going and declining. Your estrogen is not producing that much, so you're becoming dry and you're deflating. So it's like all these things are happening at 51, you just hit, and then you start having the little bit of the leak, and then you're starting to have the dryness and the pain. It's like, oh, so many things to do besides our skin treatments and everything else, right? So, but it's a category.
Yes, exactly, but it's not the end. I mean, 51 is not the end. Menopause is not the end. So it's
that's what I hear from you now.
Yes, we are here to explain that it's just one step in life, and there are a lot of things to do. Even if you don't do everything in one time, you have time to step by step
improve and feel better about yourself.
Improve.
Exactly.
Yes.
You're right. There's possibilities where before it was taboo, you lived with it, and now you just have those possibilities that are open and that we can just talk about it. I think it's amazing, really. So we can plan an extra budget of anywhere from, let's say, $500 to what, $5,000, depending on the condition.
One injection is 350 euros. So I know it's $400, I think, maybe around, roughly.
Okay, so it's affordable. You could find the money to feel better. I guess that's the point. Of course, with your hygiene products to maintain your good health and the most important, the pH, the pH balance. That's so much information, and I hope we're going to see you in Montreal, and I hope we're going to have you back into a capsule of information like this. Dr. Bensmail, it's such a pleasure to have you, and I want to say a big thank you for being with me today, and I hope to see you soon. And stay safe.
Thank you very much.
And stay safe. Take
Stay
care.
safe, you too. Bye.
Thank you to all the
Bye-bye,
audience.
everyone.
Thank you very much.
Thank you for coming. Bye.
Yes. Bye-bye.